Okay, good morning everyone once again. Hope you had a splendid night rest. Alright. So today we are going to be treating a very interesting and delicate topic. It's called brain control and stress management. Brain control and stress management. That is how we can control our brain and how we can manage stress successfully. Okay, the human brain is a very complex and organized structure. As we all know, it is made up of different compartments, and each compartment does distinctive works and functions. So the brain can be divided into several lobes, majorly four. We have the frontal lobe, that is the front. We have the parietal lobe, which is middle, that is the middle part of the brain. We have the temporal lobe, which is found at the sides. Then we have the occipital lobe, which is at the back. Now, let me just tell us a very small story. In the 1960s, there was a man that was working for a railway corporation. So this man was known to be very gentle, calm, well coordinated, and he has good morals. So one particular incident happened. He he actually had an accident at the temporal part of his head. He hit the temporal part of his head, that is the temporal lobe of his head. So he came out of coma. Then on coming out of coma, this man suddenly became very vulgar. This man suddenly became very aggressive. Someone that was known to be very gentle, very calm, but all of a sudden he became very aggressive, and people were like, no, no, no. Then the company sacked him because of the change of his attitude. So why am I still giving us this story? I'm just trying to let us know that the brain is like the central and like the CPU of our body, of ourself. Now, I said we have the frontal lobe. Now, let me give us a brief illustration. In the medical world and currently in advanced countries like that, people with protruding, scientists can actually look at you and know if you are capable of some criminal activities. Now, take for instance, when someone is being arrested for committing a crime, they can actually study the shape of your head to know if, no, I'm serious, you can actually study the shape of your head to know if you are capable of committing this kind of crime. Yeah, medical world has actually gone far into that. Now that's what I'm saying. Like, okay, when someone has, just calm down. I'll explain myself. When someone has a protruding part, which is the frontal aspect, the frontal part of the brain. Don't look at someone else. Just the protruding part of the head, that is the frontal part of the head, is known to be characterized by higher level of intelligence. People with this type of forehead that is protruding, they are known to have higher level of cerebral functions. While people with the temporal, that is the side, which is, if it's somehow bulky or big or something thereabout, such people are good with memory and they are very good with hearing. Their hearing sense is quite elevated. While someone with the occipital, that is the occipital lobe, the back, they are known to have very good eyesight. That is, their vision is very clear, and they are very good with seeing. People with the parietal, which is the middle, they are known to be very good with sport and anything that has to do with balance. So let's move on. Brain control. Cerebral control is an inherent faculty of normal person. That is, if you are a normal person, you are expected to be in control of your brain. Now, by normal cerebral balance, that is the ability for you to balance your thoughts, we mean that sensation, impression, or idea can be controlled by reason, judgment, and willpower. There are some people that we know, probably, maybe we've met someone or something, they just act they don't, their actions does not go through a process which is supposed to be reasonable. They do not ruminate, they do not regurgitate their thoughts, like they don't filter it, they just act. Such people are known to have, they don't have control of their brain, they don't have cerebral control of their brain. So we have what we call insufficiency and of the brain, which is defined by a defect in control. That is when you can't control your brain properly, when you are not in control of your thoughts. Then we have insufficiency of the brain. Now I want to ask us a question. Does anyone know where the mind is? Our mind. Our mind. Does anybody have any idea of what our mind is? Is our mind in our heart? You know, some people tell you your mind is in your heart, probably you follow your mind. So I want to know, does anybody know where our mind is? Our mind is abstract. All right, anybody else? Do you have any idea where our mind is? Our brain. All right. All right. Okay. Before the end, we'll get to know. Okay. We also have another stuff, instability of the brain. This is characterized by a shift in the normal state for no apparent reason. It is associated with a brief period of critical depression and personality change. So, when we have insufficiency of our brain control, we experience a lot of things, anxiety. In severe cases, we can have confusion, which leads to indecision, idea being mixed up with no direction, obsession, and incapability of completing what we started. So there are some instances whereby you started something, probably you're working on something, and you're not able to bring it to completion. It might be one of the symptoms that you are suffering from insufficiency of your cerebral control. When you are in depression, when you are obsessed about something. I know obsession, everybody, you are probably obsessed about something, but there are some people, we all daydream. Daydreaming is part of how we renew or rekindle our mind, how we keep our minds in shape. But there are some people, when they are suffering from this insufficiency, they don't even know that they are daydreaming. You know, they are so lost in the thoughts that they forgot that they are not even currently present. That's why you'll be talking to someone and the person is not actually there, but the person is seated, the person is somewhere else. Such kind of little symptoms is a sort of little symptoms is just signifying that such person is suffering from insufficiency of the brain. That is, you cannot fully be in control of your own thoughts, of your own brain. Okay, then in terms of insufficiency, we have the latent period and the active period. Latent period, that means it's just beginning. That's not really gotten to the secondary state. It's just starting. Then the active period is when it is really happening. It is characterized by anxiety, fear, anguish, inferiority complex, and the likes. Okay, we have the effect of body system and organs. The effect of body system and organs, that is the effect of this brain control when we are suffering from insufficiency of the brain on our body organs. I don't know, maybe you've been in a situation, let me cite an instance, whereby you are so tensed that something is going, maybe you want to check your results, your school results, and you are scared, okay, I will fail or something. I don't know, some people have this kind of effect, this type of stomach effect, whereby they feel like they want to go to the toilet. I don't know if anybody has experienced that. You feel like you want to go to the toilet, there's this disorder, like you just want to empty your bowel or something, or you want to urinate or something. Now, this type of stuffs are being caused by anxiety, which is as a result of us not being in full control of our brain, of us not being in full control of our cerebral, that's our cerebral. So we have nervous disorder. There's some people whereby when they are tensed, when anxiety is setting, they literally just forget 2 plus 2. They won't even know what 2 plus 2 is. When you ask them something, they know. It happens in exam halls, whereby you are so anxious and you can't even be in control. Then what you know normally, then you start fumbling and you don't even know it. We have muscular disorder. There are some people that they are when they are being tensed, they can't really get their coordination properly. They can't work well, they don't have balance. All these things have what it affects our brain. Now let me explain. Before I started, I said we have the frontal, the temporal, the parietal, and the occipital. Now, and I said we have the frontal lobe, that is the front, the parietal, the middle, the temporal, the sides, then the occipital, which is the back. Now, the frontal aspects are something we call the Broca area. This Broca area is known for speech, that is speech, the way we talk. It controls the way we talk, the way we react, our emotions. That's what this place is all about. Then the temporal, it has what deals with our memory and how we perceive, how we hear instruction, how we hear words, our hearing sense, our hearing faculty. Now, we have this parietal, which I said is responsible for balance in our body. Now, when someone who is anxious, who has anxiety currently, this feeling, there's a way it is being coordinated to your brain, and the brain just interprets. So when you are anxious, when you have anxiety, it tells on this parietal aspect of your brain, which controls your balance. And I know I said the parietal aspect controls the balance of our body. So it controls the balance of our body. So when we are anxious, when anxiety is setting, then it affects this parietal aspect. There are points on the Broca area that it affects. So that point temporarily just cut off. So that's the way it affects our balance. That's the way it affects the way we talk. That's why some people, when they are anxious, they can't really talk, they can't really flow fluently the way they were supposed to. Then it has effect on our sense organs also. That is our eyes, our ear, our skin, and so on. That is when we are anxious, when we are not in full control of our brain, our sense organs, some people, something might be sitting right in front of them, they would not see it. You might talk to them, they would not hear. You might even tap them, they might not even know, they might not feel. They are literally just absent, they are absent-minded. Now, let's move on to stress. Stress is defined as the psychological reaction of an organism when adapting to all forms of aggression. That is, stress is just defined as the reaction you give to the action that is being brought to you, the way you react to an action. That's what stress is. Now, present day society are both authors and hostages of our own evolution. What this means is our current trend of life, with everyday hustling and bustling, it just contributes to our stress level. It contributes to the way our approach towards life. Now, there are a couple of ways whereby we can manage stress. Number one is to keep a positive attitude. Positive attitude being optimistic about situation, even when it seems totally off. This whole thing boils down to our mind game. It just boils down to the way we see things, the way we see the world, the way we see everything. So just keep a positive attitude. Another point here is accept that there are events that you cannot control. Just like you are born in Nigeria now, you are feeling bad and blah, blah, blah. Accept that there are some situations you can't just control. Just move on and forge ahead. You don't have to feel bad. The more you feel bad, the more you feel depressed that you're in a current situation, the worst it will be, because the best is for you to just keep moving and just forge ahead. Be assertive instead of being aggressive. Assert your feelings, opinion, belief instead of being angry. I've said that before. Learn and practice relaxation techniques. That is, you can try yoga, you can try your meditation, it relieves us of stress and the likes. Then another one is exercise regularly. I think I have to buttress on this point because a couple of us feel maybe a couple of us feel exercise are mainly a sex thing, like for males or something. No, I think exercise should be for everybody, even if it's just 5 minutes of your time in the morning. I was reading an article, and one of the known techniques of having a great day is just exercising very early in the morning. It might just be you do your sit up, push ups, pull up, whatever. It awakens your mental ability, it opens you up. Learn to manage your time more effectively. I don't think we need a lot of talk on that. Set limits appropriately and learn to say no to requests that will request excessive stress in your life. You know, some of us probably that we are into one or two things, business or something, and this thing you want to do will actually wear you down, will actually tear you up. But then we still go on and we still do it. We go to places that literally is of no use, or we do stuff that we don't really mean to do, we don't really need to do. This type of stuff actually causes a build-up of stress in our life. And in essence, when you are being stressed up, there's no way you can be in control of your brain. There's no way you can have cerebral control. There's no way you can be in control of yourself, your attitude, your mood. Make time for hobbies, interest, and relaxation. It's not all about work, 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 work. Times just make time for going out, meet up with friends, do what makes you feel alive, do what makes you happy, relax, see new places, meet new people. Get enough rest and sleep. Yeah, I don't know, we are wired differently. There are some people that they sleep for 2 3 hours, they are good, they are okay. I think the best part is to know yourself. Like me, if I don't sleep 7 8 hours, I will have issues. I will not be okay. Don't rely on alcohol, drugs, or any other external substance to feel okay. Don't rely on substantial chemicals, substances. Some people, when they are not fine, when they are stressed out, they feel the best way is to go to the bar, take 1 or 2 bottles, makes you cool off. Some people is drugs, tramadol, name it, any other stuff. They want to sleep, but then they're actually abusing this stuff, and they are not really using this stuff the right way. Seek out social support. Spend enough time with those people you enjoy. Okay, let's move on to. I have something here which is called psychoneurosis. Now, psychoneurosis is just a defect in our normal mind psychology, it's defect in our mind psychology, defect in our mind, defect in how we see things, defect in how we approach the world. Now we have the etiology of neurosis, we have the primary cause, which is hereditary. Now, the primary cause, hereditary, it is basically due to your gene. There are some people, I don't know, your parent is probably a moody type, your father is the moody type, your mother is the moody type. Normally, I don't know, maybe there is a gene for that. It is being passed on to you. It is more of an environment thing where you are born into. When you are born into a place whereby nothing happen, is all moodiness, no happiness, it affects the mind. Your mind file is being conditioned that life is not good, like everything is not fair about life, everything is not okay. And we have the secondary cause, which can either be accidental, like the instance I cited at first when the man had an accident. So his mind is being reconfigured. When he sees someone, the first thing is to become aggressive, is to become vulgar. Now, treatment can be either functional or psychological. I don't know how many of us have seen this movie, Get Out. Get Out. You've seen the movie Get Out, where the guy was being hypnotized and like. So I'm just trying to buttress on the psychological aspect. The psychological aspect, you can meet a psychologist. I don't know, this part of the world, we feel the use for psychologist is overestimated, is being overemphasized, like we don't really need it. But then at one point or the other, we think we need this mind therapy. It might be through reading of books, it might be through seeing of movies, documentaries, or even walking up to a psychologist, you know, rewire the way your mind is being configured. The mind is like the central part, what controls everything about us. Then we have the functional part, which can either be treatment, which can either be going for, okay, there's something, like take for instance now, someone might have a lesion. When I mean lesion, that is a damage of the brain. We have the brain, we have the brain is complex, as I said. That's brain stem, that's the medulla, that's the pons, and other parts of the brain. So there might be a lesion of a particular part. When there's a lesion, it's just like a cut on this particular part of the brain. Now, when there's a lesion, it means where that brain is being cut, that particular aspect might not be in control again. So doctors or surgeons can actually do a surgery on such person. Okay, so the psychological treatment, the first thing is to control your thoughts, be in control, make sure you are in control, and develop a very strong willpower. You must have a very strong willpower. Then the functional treatment, make sure you do things that you really want to do. I know it is actually hard. There are sometimes whereby your thoughts are actually telling you to do this, and you really want to do this. It's a battle between good and bad, but then you just have to keep fighting. You have to be in control. Make sure you are in control of such activities. All right. So before I end, I said something about the mind. Now, scientists cannot really tell if the mind is actually a structure or it is being abstract. Now, let's take for instance a child that is being born, a child that is being born. There's a speculation that the mind is like a bare plate, like a empty book, whereby experiences which you go through in life is just being taken down on your mind. Things you experience by your day-to-day activities is being taken down, which that's what constitutes your mind. That is, your day-to-day activities is what literally just makes up your mind. While there are some people, there's a speculation that the mind is actually in the brain. They've not really got into a consensus on this. So, but the mind actually is being controlled by the brain. The mind is being controlled by the brain. Things we see, things we do, this is what makes up our mind. And I feel we have to take care of our mind to have a positive approach towards life. I don't know if we have any question. Any question? All right. Any of the okay. The brain can actually be developed. The brain can actually be developed. Brain continually just keeps growing until a particular stage where it does not grow anymore. That's around 22 upward or so. But then there are some activities that you can actually use in building those stores. Take for instance, if you want to build your stamina and you not literally do not have stamina, like your parietal lobe is not really well built, you can actually do rigorous training exercises. You know, even when you have a bulky head, when you have a developed frontal lobe, which you are supposed to use your intelligence, you are supposed to be very intelligent, and you don't read, you don't do stuff that will make you develop in such area. You might just be, if you don't read, you can, there's no way you can be developed this intelligence. There's no way you can develop this intellectual. So you having the hospitals, blah blah blah, you still have to work, you still have to, there are still external factors that still depend. You can't say because you want to have stamina, you don't work, you don't do exercises, you don't do trainings, you don't do anything. So you still have to work. There are still external factors that will still determine if you would actually have those things. I don't know if that's understood. All right. Any other question? No question. All right.
No question.
All right.
Personally, I know I do it most of the time. You have your references that
So what do you not agree with?
I'm not asking, I just really don't agree with some of the way you can damage your intelligence or something. So people with small head like I don't think that at all. I don't think it's not.
Okay. All right. Let me expatiate on that. I think it's just correlating to what you asked. Now, no matter how small the head is, so you hear me now. No matter how small the head is, there's still a part of your head. If you look at my head now, there's still a part of my head that is well developed. There's still a part of my head now that is still much more developed, and that's like the side. I don't know. Maybe if I look very well. You say what? No, talk now. There's still a part of the head that is still, no matter how small, even if the head is like a balloon, there's still a part that will still be very developed. You might not really see it. You might not really be able to observe it. But I'm telling you the latest in the world of medicine now. When someone is convicted of a crime, they call in neurologist, that is neuropsychologist. They assess, I'm not saying it is a basis for knowing whether you committed the crime or not, but they assess, there are some crimes that a dollar cannot just perform. Now sometimes there are some terrorists that you just like, there are some acts that probably someone with an IQ of something cannot just perform. So they just use that as an evaluation. They just use it to evaluate. It's not like it's the basis. They just use it to evaluate. I'm not saying if you have a big head, you are brainy. I'm just saying there's a correlation. It's called phenology. There's a correlation, you can read up on it. There's a correlation between the shape of the head and the act and attitude, the way you react. All right.
Everything is there, and based on what you said, there's a movie called The Somatic and the Wonder Woman.
Is that what?
The Somatic and the Wonder Woman.
All right. No.
They talk about how they put that and monitor your blood pressure, your responses to the and how when they ask questions, you see movies and when they ask you questions, they put something and you are trying to write exactly. So it's true, it's going to put mind, your brain, the blood pressure is how it's covered that machine, you understand? And the part that we're talking about the position of the brain, I've read about it online, it's actually
God bless. To buttress that point, so okay, there's no consensus about that. There's no point about it in mind. Some people believe it's on the brain, some people believe it's just abstract. I don't know if you have any other question. All right. I said that already. I said there's no consensus. They've not.
Mind, my personal.
Sorry, can you be quiet?
The mind is abstract, like I said. But to add for that, the mind is like a living space.
Okay,
It's
let me come in there. Now, before now, it was generally accepted that the mind is abstract. But then in 2003, there was a study that a part of the brain, I said that a part of the brain can have, you can have an injury or an accident on a part of your brain, and you will just forget everything you've known. You've seen movies whereby someone probably have an accident, and they just forget people. They forget people they've known for years. They forget people. So there's no actual consensus that of whether the mind is actually in the brain or is abstract. Because there are some parts of your brain that when you have an injury to, you will just forget, you will dash out, you will not even remember.
But would you agree that the mind, or the brain is an organ of the mind? So
The brain is an organ of the mind. No, they actually work one hand in hand. One,
for the mind to function, you brain.
yes, you actually need the brain. I said that the mind is just like a tablet, like a blank sheet, whereby it records your day-to-day. A little child cannot have a distinctive mind. The little child will see a white handkerchief and it is nothing to it until when it starts knowing that this thing is an handkerchief. A little child is until you teach the child that okay, this is white. That's when the child knows this is white. Then when it sees white, even without trying to think about it, it knows this is a white color. I don't know if you're getting me. Okay.
So you said something about the mind that there's no consensus that the mind is
Yeah.
abstract. Can you explain something now that the baby should see something registered on the brain? Are you saying the mind is what stores the memory or the brain that stores the memory?
I don't get it. Okay. The brain is what stores the memory. The brain is
That means the mind is abstract.
no, you can't say the mind is abstract.
Can we see the mind?
You can't the mind.
Can we feel the mind?
You don't get it.
You know that your character, you can build your character from the mind.
I'm saying what part of the body is the
Now,
mind.
I'm trying to make you understand that your character, composed of your mind, what you accumulated over time. You know what I mean?
No, I don't know why it's not. I'm reading.
Okay, let's just get it straight. What's the issue? Where is the mind, man? No, let's get it straight. we are confused about where the mind is. That's the issue. Now, and I cite an example. When you have a small child, a newborn baby, does this newborn baby have a mind of his own? Can you say a newborn baby have a mind of his own? No.
Of course, yes. Yes, because if they're saying if they're relating the mind to the brain, that means if you change a newborn baby, it's going to respond. His mind has stored the response to that way. Because next time,
If I tell if I tell you follow your mind, will you if you want to take a decision, if I tell you follow your mind, will you just think about something at that moment, or you just tell me what you've registered in your subconscious?
depends on what you're asking me. It's what I know about. I'm actually thinking about.
If it is what you know,
That's what I'm
about.
saying. I'm conditional. If it's what I'm conditional,
You say?
about.
That's what I'm saying. Like there's no consensus about as to what the mind is, as to where it is placed. You know it is abstract. All right, but then scientifically, there's no consensus. You can't say it is this. You can if you say it is on the brain, I can argue and I'll say yes. I can give you fact. If you say it is outside, like it's abstract, I can argue and you can give me fact also. So there's no consensus as to that. Is that all? All right.
So please, put the link on the sheet channel. So the person will disclose it. On Saturday.